Bladder cancer is essentially a tumor that's starting on the inner lining of the bladder. So people have heard of skin cancer, because you can see the skin on the outside. Bladder cancer is the innie, if you will. It's the lining skin of the bladder that develops a tumor and can grow. So it's really an internal skin cancer. And the official medical name is urothelial carcinoma. Bladder cancer is either the fourth or the fifth most common cancer among men, and it is more common in men compared to women, and therefore it is something that we really need to be on the lookout for because of the prevalence rate. Right now there is no screening program, so there's no special tests that one can do to look for cancer when a patient is asymptomatic. So bladder cancer is picked up usually when the patient complains of seeing blood in the urine or having microscopic blood seen during a routine physical exam. If we're suspicious of a patient having a bladder tumor, we will do the diagnostic test that's called a cystoscopy. And ultimately, you do need to do what's called a bladder biopsy to diagnose the bladder cancer. Management of bladder cancer really depends on the stage of the bladder cancer. Typically, I like to think of bladder cancer in two groups. One is called non-muscle invasive, one is called muscle invasive. Non-muscle invasive cancer, a patient could keep their bladder, they can get, I call it topical therapy, and so the operation rate usually is just occasional bladder biopsies. In muscle invasive bladder cancer, then we need to do what I call it a multidisciplinary approach at treating the cancer, where we talk to the radiation oncologist, we talk to the medical oncologist, and of course urologist, the surgeon. We all work together to decide the best treatment option for a patient with muscle invasive bladder cancer. What's really great about our approach at Yale is that we have a multidisciplinary GU cancer tumor board every week where we discuss patients' diagnosis, evaluation, and management. I'm Toby Chai, and I'm professor in the Yale Department of Urology and also co-director of the Female Pelvic Medicine and Reconstructive Surgery program.